Today I have a very serious nugget. I'm going to be quoting from Could It Be B12? A book written by a nurse, Sally Packalock. And she says, in 1983 I was the picture of health. I looked fit, I felt great, I had no idea that a silent crippler lurked inside me, stealthily damaging my brain, nerves, blood vessels, and nearly every organ in my body. Because of my medical training, however, I noticed small signs that something wasn't right, and I knew enough to be worried even when my doctors dismissed those signs as nothing to worry about. I pursued the few clues and eventually obtained a diagnosis of pernicious anemia, an autoimmune form of vitamin B12 deficiency. Millions of other victims of B12 deficiency aren't as lucky. Some are infants and toddlers, left developmentally disabled for life. Some are young adults mistakenly diagnosed as having multiple sclerosis, or told erroneously that they are incurably infertile. Others are middle-aged men and women tormented by balance problems, numb hands or feet, or mysterious shooting leg pains so agonizing they can barely walk. Some are diagnosed with early onset dementia, or pre-Parkinson's disease in their 30s, 40s, or 50s. Some are people so depressed that they try to kill themselves. Some appear to be full-blown schizophrenics, and still others are seniors, living out their days in nursing homes because their doctors think they have Alzheimer's disease. It's too late to completely reverse the symptoms of many of these people, but it's not too late to protect yourself or the people you love against a similarly tragic fate. In fact, it is extraordinarily simple to prevent or completely reverse the symptoms of B12 deficiency if the deficiency is discovered in time. My curiosity developed into more than 2 decades of research on the scope of B12 deficiency. I became an expert, and my husband Jeffrey, an emergency medicine physician, also conducted research. What we learned about the prevalence of B12 deficiency, the havoc it wreaks on the entire body, and the number of undiagnosed cases is alarming. Initially, I was tremendously excited by the extensive research proving that B12 deficiency plays a role in so many seemingly hopeless problems. My excitement was short-lived, however, because most of the doctors I worked with didn't care about an epidemic of undiagnosed B12 deficiency, or that the current normal for this test was inaccurate and misleading. I was forced by my employer to sign a document stating that I would not talk to patients or their families about B12 deficiency, and I would stop soliciting physicians to test patients, drop the subject, or lose my job. This book was born out of our frustration and anger over these needless injuries and lost lives. That is a great book. So apparently it doesn't matter if you're an omnivore or a vegetarian. You may still be B12 deficient. As the author says, the limits the doctors call normal are inaccurate. And the Hallelujah Diet says it's vital for everyone to take a B12 supplement regardless of their diet. They have developed a B12, B6, B9, or folate, combination that plays a vital role in energy production and detoxification as well by that combination. And the B12 is the methylcobalamin version, which is the active form of B12, not the cyanocobalamin version, which the body must convert before it can be used. So even though there may be foods fortified with B12, the best source is still a good supplement, which I take. But I also use the organic B12 fortified nutritional yeast to make my non-dairy cheeses and cheesecakes. This, for example, is one of my wonderful cheese spreads. But if you want to make a very quick snack, why don't you just take your nutritional yeast and grab your raw almond butter. Remember, raw almond butter, not with roasted nuts, but with raw nuts. Just mix them together and make a quick spread for a cracker, kind of a little cheesy flavor there. But if you want to know more cheese, it does have the nutritional yeast, it does have the almond butter, it also has the red bell pepper and some lemon, and everybody just raves at this beautiful cheese spread. So if you don't have that recipe yet, you haven't been to my classes, just send me a note via the contact form or email, and I'll send you the recipe. How's that? Enjoy.